Hi friends, today I'll be talking to you all about scarless surgery. Whenever we perform a surgery, there is always going to be a scar. So when I say scarless surgery, what I mean by that is that every one of us have a natural scar in our abdomen, which is nothing but the navel or the belly button. So when we perform a surgery by inserting ports through the belly button, the resulting scar out of which is not visible outside, and it is all going to be hidden inside the belly button, or it is going to be on the previous scar. Hence, this is a virtually scarless surgery. So, is this scarless surgery a new technique? No, it was described 25 years back where a surgeon performed an appendicectomy for a patient suffering from appendicitis. In spite of being reported 25 years back, the technique is not being accepted by everyone. The reason being, initially when we needed to perform a scarless surgery, we had special devices which were marketed for the same. But these devices were quite expensive and it was not practically possible to use it in the Indian scenario. Whereas now with a lot of scientific advancements, we have a lot of newer instruments where we have modified our technique in order to utilize our conventional laparoscopic instruments and perform a scarless surgery very comfortably and bring about even better results than what were described initially. So, what are the procedures which can be performed through a scarless surgery and what are the advantages of a scarless surgery? Whenever you have young girls or young women and people who are unmarried requiring a surgery for some problem, the scarless surgery is best suited for them because it has a very high cosmetic result. You will not be able to see any scar outside, and even when you tell someone that you have underwent a surgery, no one would believe you because the scar will not be visible. So this is a huge advantage of a scarless surgery. So is cosmetic results the only advantage? No, not at all. You have a lot more other advantages, namely the pain associated with the scarless surgery is much less compared to a conventional laparoscopy. The reason for this is that when we do a scarless surgery, all the ports are inserted only at the level of the belly button. Here, only the nerves which are supplying the belly button are going to be stimulated, whereas when we do a conventional laparoscopy, the ports are going to be inserted at various points in the abdomen and a lot more nerves are going to be stimulated because of that, and hence the resulting pain also is higher compared to a scarless surgery. In addition to this, you also have an advantage which is similar to any laparoscopic procedure where the blood loss is much less compared to an open procedure. So when you combine all these three advantages of being scarless, pain is much less, as well as the blood loss is much less, the time taken for a patient to return home and return to their normal work or activity is much less in a scarless surgery group compared to the other patients. At the same time, the problems associated with the conventional open surgery or laparoscopic surgery are also much reduced in a scarless surgery group. So, who are the patients who would benefit with the scarless surgery? Whenever you have a problem like a gallbladder polyp or a gallstone for which you require the removal of the gallbladder, namely a cholecystectomy, this can be performed very comfortably in a scarless surgery technique. Not only this, a lot more other problems like removal of the appendix for appendicitis, namely appendicectomy, a hernia repair for any form of hernia. In addition to this, problems which women develop in the uterus like a small tumor which is benign and called as a fibroid can be easily removed using the scarless technique, namely a myomectomy can be done. In addition to that, whenever you have a benign ovarian cyst, endometriosis, a dermoid cyst, you can easily tackle all these problems using the scarless surgery technique. In addition to it, you can also use it in emergency situations like ectopic pregnancy, or you can use it to perform a sterilization, or you can use it to perform a diagnostic laparoscopy where people suffer from infertility and want to know if there is any other problem inside. In addition to it, whenever a patient requires the removal of a uterus because of a lot of bleeding or pain associated, then the hysterectomy can be performed comfortably in a scarless technique manner. In addition to it, whenever a patient has a cancer in the uterus or the cervix or the ovaries, and these are early stage cancers, these can be removed using a scarless surgery technique. And not only for the cancers which are associated with the uterus, even if a patient has a stomach cancer or a colon cancer or a rectal cancer, when this is at an early stage, these cancers can be easily removed using a scarless surgery technique. So I believe you would have understand and learnt about a new procedure, and if at all you have any more doubts regarding the same, you can contact me at Ashwin Hospital. Thank you very much.